Hey everyone, it's the Dr. Jason West program live on Wednesday night. And man, do we have a lot to talk about. We're going to be talking about nerve disease and specifically on Parkinson's disease. Now, Parkinson's disease is one of the most common neurodegenerative diseases, which means the nerves break down. It's the second most common. I'm going to tell you about the first most common shortly, but really the application for this, it's all about nerves of all types. So whether it's peripheral neuropathy, whether it's Parkinson's disease, where it's benign tremors, essential tremors, Alzheimer's disease, like there's so much application for this. So what we're going to talk about today is to go over all different types of nerve diseases and what you can do to help and to improve those conditions. And we've got some great information here, which, by the way, I just wanted to point out the banner Unbelieve Me. If you would like a report, there's two ways to get this. We've done a free nerve disease report. You can type hashtag nerve disease inside of the comments. And even better, if you'll just email us at info@westcliniconline.com. I'm going to actually put that up here right now for your report. Just go here. The fastest way to get it is to email us, but I'm going to send it in and I'm going to do it right here. So I'm going to just put this up here. Right. Just go info@westcliniconline. We are talking about Parkinson's disease, essential tremor, stone face, stumbling gait, and what to do about it. And it's tonight. And why I decided to do this is because there's so many applications for other diseases and conditions when it's related to Parkinson's disease. And one of the frustrating things that I see is patients will come in and they'll say, hey, my dad or my brother or my mom got diagnosed with Parkinson's disease. And I'll say, well, what are the treatment options? And they'll look me in there and they'll say, look, the medical community, they put them on a medication and then periodically they'll do some imaging, maybe an MRI and so. And then we just are kind of like, it's basically how bad you're getting. And what I would like to suggest to you is there's a combination approach available. There's so many things that you can do, from amino acids to black currant proanthocyanins to arachidonic acid to linoleic acid to linolenic acid. There's so many different things that we can use that will help neurobehavior, neurodegenerative conditions, and why we're going to talk about the cause. And there's so many fascinating things that I've learned about nerve conditions in preparation for this. Like I'm looking over here on some studies that one of them is rich black currant extract suppresses basically the breakdown or the advancement of Parkinson's disease. And so again, if you want a report, type in hashtag nerve disease in there, or even better, it works faster if you'll email us at info@westcliniconline.com. And so recognizing we've got a whole bunch of stuff to go over and everything, let's jump right into what we're going to talk about, and that is Parkinson's disease. I put some information and presentation together, and it's going to be a really nice journey for us. So let's talk about Parkinson's disease. Let me get my screen dialed in. There we go. It's a neurodegenerative disorder with progressive deterioration of the motor function due to the loss of a neurotransmitter, a dopamine, that's inside of the body. And so, and by the way, it was discovered not a little bit ago. Like, it's probably one of the most recognizable diseases through the course of history. And I'm going to show you exactly how far back it goes that they recognized it. And it's the second most common, right next to what we call Alzheimer's disease, so dementia. So Parkinson's is more of a movement disorder, and Alzheimer's is your thought process and your brain function. And so really, like, if you start working on nerve diseases, there's some really nice benefit to improving all of the function for the nervous system. And when you put everything in balance, so many good things happen. There's also a new breakthrough. I'm just looking over here on CoQ10. And when I say breakthrough, more recent literature on CoQ10 and Parkinson's, but I got to tell you, it's all about arachidonic acid, it's mRNA, and then what they call is cellular blueprint therapy. That's how we can make a really nice impact on arachidonic acid and what we can do to protect the myelin sheath, which is usually associated, a lot of times people think about that's associated with multiple sclerosis, but there's a Parkinson component to it, and neurotransmitters, and why amino acids and why movements are so important. So going back and looking at Parkinson's disease, it's the progressive loss of muscle control, which leads to the trembling limbs and head while at rest, and the stiffness, slowness, impaired balance. It may become difficult to walk, to talk, and to complete simple tasks. Okay, let's see. Here we go. Okay, the progression of Parkinson's disease is different for everybody, from person to person. Many people with Parkinson's disease live a long and productive lives where others become disabled. And this is so important to consider because Parkinson's disease and nerve disease are as different as your fingerprints. You know, what happens to a cousin or an uncle or someone that you know that has Parkinson's, and then you compare it to another person, and one person may progress. There are some people that have been diagnosed with Parkinson's that unless that you, like they tell you, you would hardly believe that that's what's happening. Okay. Parkinson's complications a lot of times lead to falling disorders and the life expectancy with people with the disease. Guess what, you guys? It's about the same. It's not life-shortening diagnosis. It's just life-impairing diagnosis. Most people that get it are 60 years or older. It's a life expectancy is rising. The numbers with Parkinson's, it's anticipated to increase in the future. And this is the kind of fascinating part, is that it was diagnosed 5,000 years ago. There was an ancient Indian civilization that recognized that a plant containing therapeutic levels of levodopa, which is one of the medications for Parkinson's, and it was named after a British doctor, James Parkinson, in 1817. So we're 204 years from the formal diagnosis, and 5,000, or actually 7,000. We have 5,000 plus the 2,000 after, so 7,000 years of disease, recognizing that plants can have an amazing impact on Parkinson's disease. But we're not really exactly sure what it is, and what I think it is, it's a genetic susceptibility, and this is my opinion, aggravated by infection and pollution. That's what I think. It turns these genes on that causes this stone face to occur. It causes the trembling, and it also can cause the stumbling gait and the lack of coordination that we see so apparent. So some of the things that we see inside of Parkinson's, it's really not a diagnosis based upon a blood test. It's signs and symptoms and an examination that occurs. And then what happens is, usually in the presentation of primary symptoms, is tremor, of stiffness, of slowness, impaired balance, a shuffling gait, where you take really short steps. And then secondary concerns, because no one likes to be diagnosed or no one likes to experience a degenerative disease, is anxiety and depression. And there could be a confusion that frequently can occur in the later stages. And most people are diagnosed 60 years or older, but I've seen it in people obviously in their 40s. You can rare people you'll see younger than that. And with proper treatment, again, the life expectancy is not shortened with Parkinson's disease. And so when we start talking about these different stages, the symptoms are mild. They don't really interfere with the person's quality of life. Stage 2, they worsen, and the daily activities become more difficult, and they take more time to complete. In stage 3, or what they call mid-stage, that's the loss of balance. It moves more slowly. Falls are common, and then certain conditions like dressing, eating, brushing your teeth are really affected. And then stage 4 becomes severe, and the patient will need assistance walking and performing activities. And then stage 5 is unable to really function and needs full-time assistance. Now, some of the testing associated with Parkinson's disease is something called a SPECT scan. also called a transporter scan or data scan. Although this can help support the suspicion with Parkinson's disease, again, it's back to the physical examination, the neurologic workup associated with Parkinson's. And Parkinson's, there's no specific test for it. That's one of the difficulties, especially early on. There's a lot of different things that can cause neurotransmitter and nerve disease associated with it. But that being said, the lab tests, and I think that these are so important to rule out other conditions, but not just always from a disease diagnosis standpoint, but also to recognize what's happening with the white blood cell count. Is it going up or is it going down? Is there an acute or a chronic infection? We want to look at your trace mineral levels, especially your protein level. I think this is so important. So if you've had a recent blood test, you should be looking is what your protein level is. Should be around 7.0. If it gets higher than about 7.4 or lower than about 6.7, what's happening is you are not utilizing your proteins very well. And so what happens is it stresses out the entire body. And this is one of those simple tests inside the complete metabolic panel that gives you enormous information. I also think that the liver enzymes are so important. And yes, if they get too high, you start thinking of steatorrhea, which is a fatty liver. But you also start thinking of if the hormones are functioning very well. So if your liver enzymes are too low, guess what? Your liver's not working. And it's difficult to create hormones, and the hormones allow organs to talk to each other. If organs aren't talking to each other very well, guess what? We start involving the nervous system to a higher level. You're going to have increased stress inside of that hormone system. And so looking at liver enzymes and the cholesterol function and process are so important in looking at neurodegenerative diseases. And later on in the presentation, I get to share with you some of the stuff that I see really nice improvement in nerve conditions. On Parkinson's disease, I absolutely think that you can minimize the effects of the disease with diet, with lifestyle, with advanced nutrition, and using a combined approach along with medications. So there's no such thing as a lab test that's associated with Parkinson's disease. An MRI, an ultrasound of the brain, a PET scan, which stands for positron emission tomography, helps to rule out other disorders. But really, it's kind of looking at, is the brain, and the central nervous system essentially shrinking. So when we start talking about, what can we do, treatments for Parkinson's disease, we want to make sure, we get rid of that everything possible, with any type of chronic disease. I see so many chronic, complex, difficult conditions that come into the office. And what I tell them is the same thing with any nerve disease is, look, you want to use the best of all of your resources. You want to know what the diagnosis is, what options are available, what studies are available, what functional medicine, integrative, alternative medicine, because at the end of the day, if we can do everything possible to put the body back in balance and back in order, and sometimes it's a prescription approach, and sometimes it's a prescription and a nutritional approach, and sometimes it's just a nutritional approach, it's a lifestyle approach, and I say this every presentation that we do. It's so important to get everything balanced as possible. So let's start going into some of the treatments for Parkinson's disease. Medications are designed to increase or substitute for dopamine. When you get a lack of dopamine, what happens is there's a short circuit inside of the nervous system. And so then what happens is the muscles fire without a reason coming from the central nervous system. So initially, prescriptions, there's a lot of, at least when I've seen mid-stage and later stage Parkinson's, people say that, it really helped a lot. Usually the benefits of the drugs diminish or become less consistent. And some of the prescriptions that are really common with this, the carbidopa, levodopa, dopamine anergists, MAO inhibitors, COMT inhibitors, anticholinergics, and amantadine. And this is why inside of the office, I have brought in a medical provider, because I am not someone that has an in-depth knowledge of those drugs. I'm not a pharmacist. I'm not a medical doctor. And so when you use a blended approach of someone that understands the drug pathway, and then we can add some advanced essential fatty acids, arachidonic acid, black currant proanthocyanins, or what they call BCP medicines that really help to stimulate the nerve system and to give the body neurotransmitter building blocks, I see really good outcomes with that. So I'm not going to go into depth on the prescriptions. I'm just going to talk about the classifications. There's also in advance kind of a Hail Mary situation. There's some considerations for doing something called deep stem, and this is basically where they put an electrical device inside of the nervous system to try and basically have these electrical impulses control the brain and the movement patterns and stuff like that. And they don't do that until, obviously things are uncontrollable. I haven't had a lot of clinical experience with this. I wanted to comment on it because it's inside of all of the Parkinson research, but I don't remember working with someone that has had a significant improvement with the deep brain stimulation, and maybe it's just because I haven't run across them yet. Now, when we start talking about other things that we can do, the whole picture is this: prescriptions have a tendency to wear off over time. Imaging usually shows you how bad you are, and surgery is a last resort or last component of that. And here's what I think is so important. So I want to come back and talk about this just for a minute, because here's what I think is overlooked in medicine, and it's such an important component. This is one of my very favorite studies. It comes out of the British Journal of Medical Practitioners. Was written by a consortium of medical providers, and this is power. And the reason why it's so powerful is it literally shows you that there can be chronic infection either from bacteria and viruses that cause the neurodegenerative, psychiatric, autoimmune, and fatiguing illness. And this is one of the big write-ups inside of this paper. It comes inside of our nerve report. So if you guys aren't aware, or you're just joining us, there is a report that we put together. Please comment on it, called Nerve Disease. And it takes us a couple days to go through and find the comments inside of our YouTube and our Facebook channel. But if you want the quickest way to do it is just to email us at info@West Clinic Online. And we've put the study inside of the information packet. And there's a specific part of the study that talks about infection and how it disrupts the neurotransmitters. And if you think about what's happening from a nerve impulse that comes from the brain, and it goes down the central nervous system, and then it goes to the peripheral nervous system, and it controls the muscles. Like there's a conscious thought that's saying, it's time to move. And then there's a sympathetic and the parasympathetic nervous system that have to act in concert, because if I move my arm, like I have to tell my biceps to contract, and I have to tell my triceps to relax, otherwise I can't move the arm. There's all that process. Well, when there's not enough neurotransmitters in the system, what happens is the nerve will short circuit, will come in and out, and it causes this movement disorder. And this study, which I think is one of the most important things that I've ever ran across, talks about how we can have herpes simplex 1, 6, 7. We can have a Lyme disease component. There can be other bacterial infections associated with it. And so I think one of the most important things that you can do for Parkinson's disease is actually to get the body to be as healthy as possible and also stimulate the immune system. So what are we talking about that? It's time to get your body on a really nice schedule. So you go to bed at the same time, you get up at the same time, and I kind of feel like it's a broken record because you want the whole body holistic approach with this. You are what you eat, you are what you absorb, and so I tell people you eat as clean as possible. Movement is such an important part of life. And so your exercising may increase your muscle strength, flexibility. And you want to be careful with the Parkinson's diagnosis because it does disturb your sense of balance. And so you want to make sure you don't move too quickly. You aim for your feet to be flat on the floor, heel strike first, foot flat, and then toe off. If you notice shuffling, chop and check your posture. It's best to stand up as straight as possible. A lot of times people will stoop because they think that that's more of a balanced position, and it's actually the opposite. Keep your eyes horizontal to the horizon. Avoid falling, which is, be cautious. Don't carry things. Distribute your weight. Avoid walking backwards. This is all like common sense things that are so good for overall health, but specifically health. And so when we start talking about what can we do from a supportive standpoint, and this is what I'm really excited to share people with, is because there are some things in functional medicine and nutritional journals that are coming up that are just not really paid attention to in the medical community. And the reason why is because the medicine is focused on drugs and surgery. Let's go over and let's support that dopamine process by helping the immune system. I think that's the most important thing to do first. So there's things that are herbal therapies. There's vitamin C, there's vitamin A, there's vitamin D3. We want to protect the cells with essential fatty acids. And essential fatty acids are flaxseed oil and astaxanthin and evening primrose oil and branched chains. Amino acids have a place in the neurotransmitter component. But I think it's so effective to help people to get really, really healthy fats. And I'm going to talk about the arachidonic acid pathway and why it's so important. And that is basically linolenic and linoleic acid. So that's right here in the middle of the slide. I'm going to try and get myself out of the way. And so in the side of that slide, it supports the integrity of the myelin sheath, but it's also really important to understand that Parkinson's disease struggles with converting of linoleic acid and linolenic acid into arachidonic acid. Now, the arachidonic acid is basically an essential fatty acid that's inside of the central nervous system. And this is something that my grandpa taught my dad, and my dad taught me. It goes back, probably 80, 90 years now, that if you can get increased those types of acids inside of your system, then what happens is it supports your central nervous system as a whole. The other thing that I talk about frequently is something called protomorphogen therapy. And protomorphogen therapy is basically a specific way that codes for the DNA associated with different organ systems. So there's a protomorphogen therapy for the liver. There's a protomorphogen therapy for the kidneys. And guess what? There's protomorphogen therapy for the nervous system and the muscles. So if we have people that have Parkinson's disease that have difficulty in movement because they're feeling unstable, or it's a stage 4 type situation, we want to support the muscle building system by using that specific DNA system where it tells the body, hey, we need to go into muscle repair mode. We need to go into nerve repair mode. There's also some advanced considerations that are really important for Parkinson's disease. I think neural therapy, which is a German treatment where you can literally take a B vitamin, a little tiny syringe and a small needle, and basically you go and you stimulate the skin over the muscles and the organ systems. It's like an advanced acupuncture treatment, and it makes the sodium potassium channel gates hyperpolarize, depolarize, and repolarize. It's a really nice computer reset way for the body. There's a fantastic oxidative medicine treatment called ultraviolet therapy, ultraviolet blood irradiation therapy, major autohemotherapy. That's inside of the report we've put together. I love vitamin C because it donates electrons to the body and it turns the immune system on in cases for nerve degeneration. There's more and more therapies that more and more studies that are showing that light therapy, not only light from the sun, but red light therapy at specific nanometer wavelengths, and purple light therapy and green light therapy, that they can stimulate the cells and stimulate the body to basically uptake energy. I mean, light is so important. We know our risk factor for certain is for people that have stage 3, stage 4, and stage 5 Parkinson's disease, that one of the worst things that we can do for them is not allow them to get outside into the sunlight. I'm going to pull up the study. Okay, here it is. The study is in Medical Science and Monitoring, 2019. It says reduced exposure to sunlight significantly associated with increased risk of Parkinson's, There's also a meta-analysis provided evidence that melatonin improves sleep quality in patients with Alzheimer's disease and Parkinson's disease. So many times people think that melatonin is just for sleep, and it helps to regulate your neurotransmitter pathways. I see really good outcomes in aggressive melatonin therapy. The other study I wanted to tell people about is black currant anthocyanins have the potential to treat neurologic conditions associated with interleukin growth factor 1 deficiency. And so what does that big mouthful mean? It means that black currant oil, which is one of your options for essential fatty acids, has an amazing therapeutic effect with certain people with certain neurologic conditions. And I recognize I'm saying certain twice. But the downside of taking black currant oil is nothing. There's no downside to that. And then some people have made significant improvement associated with black currant oil, arachidonic acid, linoleic acid, and then also having deep-seated meditation. I like to do what they call a theta pod treatment, where basically it helps your body get into a state of deep meditation. And we think that it causes the oxytocin and dopamine to increase in the body. And literally, the body has a chance to reset, to open, to close, and to reset. So that's a lot of, just a real quick overview. We can spend hours and hours associated with Parkinson's disease. For your free nerve report, you can type in nerve disease inside the comments, or you can, even better, the fastest, most direct way to get information to get a free nerve disease report is just email us at info@westcliniconline.com. That's a brief overview of nerve diseases, particularly Parkinson's. So the takeaway is this: you want to increase your vitamin D levels. You want to make sure you're getting in the sunlight. You want to give the body building blocks for not only myelin sheath and the nervous system, but you want to do specific amino acids associated with the neurotransmitter pathways. And in my opinion, when you have a stage 3 Parkinson diagnosis, you want to use the best of all worlds. We're just going to add some specific branched chain amino acids, some things that allow your body to create arachidonic acid, some protein precursors. We want to stimulate your body to have healthy muscle and have healthy nerve function. And if you use the best of all processes, what happens is we're super, super pleased with that. So that being said, that is the broadcast tonight. I'm so happy that you guys are here and you're presenting with it. Next week, we're going to do tics. We're going to talk about that. And we will see you inside of the next program next Wednesday night at 6 o'clock. For those that are inside of our inner circle, we're going to the Thrivers program, which is the specific question and answers. We will see you on the next Wednesday night program. I'm Dr. West. We'll see you later.